Why is pancreatic biopsy analysis so skilled? Imagine trying to take a tiny sample from a deep, hidden part of the body without causing harm. That's what makes pancreatic biopsy analysis so impressive. The pancreas sits deep inside the abdomen, tucked behind the stomach and surrounded by vital organs like the liver, spleen, and large blood vessels. This makes reaching it tricky and requires special techniques. Doctors often use endoscopic ultrasound-guided fine needle aspiration or core needle biopsy. These procedures involve inserting a thin needle through the mouth and stomach wall, guided by real-time ultrasound imaging. This allows precise targeting of the tissue without making external cuts. It's a highly skilled process that needs expert training in both endoscopy and imaging interpretation to avoid damaging nearby structures and to collect enough tissue for analysis. Getting good samples from the pancreas is not always easy because the tissue can be fibrotic or necrotic, especially if there is a tumor or chronic inflammation. This means the tissue may be scarred or dead, making it harder to get a representative sample. The tissue samples are often very small, so pathologists must be extremely careful and skilled in analyzing limited material. They need to distinguish between benign cells, inflammatory tissue, and cancer cells. Pancreatic cancers can look very different under the microscope, so expert pathological evaluation is essential to identify the exact type and how aggressive it might be. Performing a pancreatic biopsy also involves managing risks. Because of the procedure's complexity, there is a higher chance of complications like bleeding, infection, or pancreatitis. This requires careful patient selection, thorough preparation, and close monitoring after the procedure. The entire process involves a team of specialists working together, which adds to the skill needed. In essence, pancreatic biopsy analysis is a combination of advanced technical skills to safely access a difficult area and expert interpretation of very limited tissue samples. This high level of expertise helps ensure accurate diagnosis of pancreatic cancer, guiding effective treatment options while keeping the patient safe. It's a perfect example of how medical skill and technology come together to tackle one of the most challenging areas in diagnosis. Always remember, if you or someone you know needs a pancreatic biopsy, it's important to trust experienced healthcare professionals who specialize in these complex procedures.